I'm Dr. Julie O'Toole for the Medical News Minute. Along with our partners RealDX and the Cartini Clinic in Portland, Oregon, I would like to present the case of an eating disorder in an 11-year-old boy. Let's listen to the patient interview.
Your problem with eating started kind of suddenly, didn't it?
Yeah, I don't remember.
You don't remember? Your mother told me it was kind of at the start of football season. Do you remember that?
Yeah.
What happened?
Oh no, it just sort of started.
How did it start?
I didn't want to eat.
You didn't want to eat anything or certain kinds of things?
Not really anything much.
That's kind of what your mom told me too. She told me that, and you told me, that there was kind of a voice in your mind.
Mm-hmm.
Do you remember that voice?
Yes.
What was it telling you?
Not to do certain things, like not eat some days, only drink water, exercise.
Not to eat some days, only drink water and exercise?
Mm-hmm.
This eating disorder is commonly thought to be associated with young girls, but in fact, it also occurs in young boys. Their presentation may differ somewhat, but the diagnosis is the same. What is it? If you suspected anorexia nervosa, you were correct. In this film clip, the young boy is telling me about the rules his eating disorder has imposed on him, which then command his behavior. Off camera, I was told he refuses to allow himself to sleep in a bed because it's too soft and he does not deserve it. His former love of sports has degenerated into relentless, solitary movement, the purpose of which is to relieve his anxiety about food and body weight. He is harsh in his self-judgment and calls himself stupid and worthless. This little boy does not feel he deserves help and cries at the thought of the pain he has caused his family. He hears a voice in his head that tells him to drink only water and to exercise. Voices like this, common in young patients with severe anorexia nervosa, are sometimes referred to as the eating disorder voice and are not considered auditory hallucinations. However, the short-term use of small doses of an antipsychotic medication may be necessary to overcome delusional fears associated with the start of refeeding. Anorexia nervosa in boys or very young children may show some or all of the features of the adult illness. Boys may focus on getting fit or getting muscles rather than on being thin. The motor restlessness they commonly exhibit is partly done consciously to burn calories and partly is unconscious and unstoppable. They may even injure themselves. The take-home message is this: anorexia nervosa occurs in both boys and girls and can be seen in children as young as 6. It can present typically, as in the adult form of the illness, or atypically, but the treatment is the same: food. No other medication substitutes for it, and without it, the child will not get well. I'm Dr. Julie O'Toole for the Medical News Minute.